Distance can be a major barrier to accessing quality healthcare on time. That's where Angel Flight East comes in. Welcome to Takeoff Talk with Angel Flight East, a nonprofit dedicated to providing free flights for children and adults who need medical treatment far from home. We don't know how many people forego medical care because they don't have accessible transportation, and that's what this podcast is here to change. Join passionate AFE staff members Jess Ames and Maddie Beck as they share real-life stories from people who have used AFE services to get the care they need when they need it.
Hey, frequent flyers, welcome back to another episode of Takeoff Talk. You're here with me, Maddie.
And me, Jess.
And today we have a friend from a partner organization, Lisa with HCMA. Lisa.
Hi, thanks for having me, guys. Look forward to the conversation.
So do you want to give our listeners a background of what, who, and where HCMA is? Give it the whole who, where, and how.
Absolutely. So HCM stands for Hypertrophic Cardiomyopathy, and we are the Hypertrophic Cardiomyopathy Association. And we are an organization committed to patients with a genetic heart muscle disorder. So HCM can be a lot of different disorders under one spectrum. So there's a number of different genetic mutations that cause HCM, and we serve all of those big-hearted community members. And most of your listeners may have heard of HCM as the leading cause of sudden death in young athletes. So when you've seen the headline where a young person has died suddenly and unexpectedly, and they come back and say, oh, he had an undiagnosed heart problem, 40% of those turn out being HCM. But that's not really who's affected the most commonly. We are the most common genetic disorder of the heart that is currently known and understood. And that means our patients are struggling a lot of time with delayed diagnosis, misdiagnosis, and frankly, being a bit misunderstood because we kind of look normal. We don't look like we have a problem. We're not limping. We don't have a cast. There's nothing visual about a heart problem. I myself was diagnosed at 12. I have a very long family history of HCM. So we are here to provide support, education, and advocacy for these people worldwide. And we predominantly have the biggest footprint in the United States, but we also work in places like Sweden and Brazil and Australia, and we have patients all over the world. That's what we do. And we also have a program called our HCMA Recognized Center of Excellence program, which is fantastic. We have 50 partner organizations around the country. The tricky part is people with HCM don't always live right next door to a center, and getting them to those centers is highly challenging because it becomes very costly, it becomes very time consuming, and we want to make sure patients get access to that high level care as quickly as possible and as easily as possible. So that's why we were really excited to start a partnership with Angel Flight and to be able to provide services through something we call the Lori Fund, which provides travel stipends for families needing to go to high-level Center of Excellence care. And that's kind of what we do in a nutshell.
All right. So now, being such a common, not so common condition, how many different centers are there that you would consider a center of excellence for HCM?
Right now, there are about 50 in our network. We have another 20 that we're working on throughout the country, and we have international programs that are building out as well. So the tricky part about HCM is your community cardiologist might be able to spot it in some cardiac imaging, like an echocardiogram, but it's not one disease. There are multiple genetic mutations that cause different presentations of HCM. We're not really easy to figure out. Some people are at very high risk of something called cardiac arrest, which I talked about earlier. Other people have problems with the blood leaving the ventricle. It's called obstructive HCM. You may have seen some recent commercials because there's a new drug on the market for those with obstructive HCM. So that word might sound familiar to some listeners. But there's also people who have atrial fibrillation that's related to their HCM. And other people may need open heart surgery, and other people may need other procedures or other drugs. that are not commonly used in the general cardiac office. So not every cardiologist can manage every aspect of HCM, which is why we have high volume multidisciplinary programs. So the surgeon, the electrophysiologist, the electricians of the heart, the imaging people, the genetics people, they all work in one practice, but they don't typically see the same patients on the same day. But when you go to a center of excellence, you can have one-stop shopping. You get the electrical guy in there, you get the plumbing guy in there, you get the genetics person in there, and they can look at you and your family and go, oh, now we understand what we need to do for you. What you do for me might be different than what you do for my daughter versus my niece versus my nephew, but you have certain traits that run throughout a family that indicate risk of things like sudden cardiac arrest or heart failure. And about 5% of our population go off to transplantation.
Wow, that's interesting. So we learned about HCM. Somebody in our world of Angel Flight actually has HCM and was traveling to Florida to see his local doctor. So I know you said it's such a misdiagnosis, and some people find out much later in life that they may have HCM. So how do you outreach to patients and those healthcare facilities that are centers of excellence, just saying you are a resource for their families who may be misdiagnosed or wondering what they do next once they find out their actual diagnosis?
So, complicated question. I will give you as a succinct answer as I possibly can. So, if you've been diagnosed, the local cardiologist typically can get the name of the disease right and understand your anatomy to a basic level. But some of the imaging that we need to do is very specialized, and it's cardiac MRI. We're looking for the amount of scar in your heart. We're looking at the exact anatomic presentation of your HCM. You could have thickness in the middle of the heart called the septum, the wall that separates the right and left. You could have it at the base of the heart, which is called apical HCM. You could have non-obstructed, you could have obstructed. And every patient with HCM gets some different acronym thrown on them, but it's all one disease. So when your local doc sees HCM in the big umbrella name, the Center of Excellence starts to parse you down to where is your hypertrophy? Where is your risk? What is actually happening inside of your heart? Sometimes they have problems with things called your papillary muscles. Did you even know you had them? Probably not. But there's these two little muscles inside of your heart that help your mitral valve open and close. And then some people with HCM, they're kind of wonky. They're attached, they're moved the wrong way, they're pulling the valve in the wrong direction. So only a specialist can really see these very tiny nuanced differences. So you go from the local, you go to a center of excellence, and then you work in partnership with your local cardiologist and your center of excellence. So I happen to know the person at Angel Flight who has HCM. So that's kind of how we came to know you. I knew them. They started working for you guys. They're like, oh, we can put this together. I'm like, absolutely. Let's do that. And let's find out where all of these other patients are hiding throughout the country and get them to high-level care. It's really important that these particular families get to the right care at the right time before things can go really badly, really badly. Like young people die, they have cardiac arrest, or they go into heart failure. We can't waste time with misdiagnosis or misunderstanding. We have to get people to the highest level of care possible as quickly as possible. And typically, once you get an assessment, then it's checking in with your center maybe every 1 to 2 years, unless your symptoms change or you're moving towards transplant or something on that level. But most times it can be just checking in with these high-level specialists once or twice a year, or once or twice every other year. I mean,
Super interesting. So is there ongoing imaging that has to happen for an HCM patient just to understand like the progress of the condition?
yeah, that's why we do imaging like about every 1 to 2 years in HCM to see, is the heart changing? There's all different anatomic language that I can use that would probably put most of your listeners to sleep. But we want to see, is there more outflow tract obstruction? Is the blood having a harder time leaving the heart? Is the atria getting too dilated? And that puts you at risk for atrial fibrillation, which is a leading cause of stroke. So you have to kind of keep an eye on what your anatomy is doing, how you're feeling. People with HCM have a really nasty habit of not understanding what their own symptoms are and how limiting they become. As I mentioned earlier, I was diagnosed when I was 12 years old. I would have chest pain while I was roller skating with my friends, and everybody thought it was just, strange that I would have cardiac symptoms at 12 or 13. But over time, my disease progressed, and I ended up having a stroke at the age of 21, and I'm partially blind in one eye because of that. And a few years later, I had my first pacemaker put in, and then I had a defibrillator put in a couple of years after that. And then 7 years and 30 days ago or thereabouts, I had a heart transplant. And I took my heart out and I got a new one. And my donor's name is Brandy. And that's all I really know about her and her family. But I'm here today because of the availability of high-level care, working with a center of excellence, and getting myself all the way up to and through transplant, and got right back to work literally from my ICU bed because I'm a workaholic. But it made me happy and I did it. And I'm still here to serve this amazing community of big-hearted folks.
That's
That's so cool.
incredible. How long has HCMA been in existence?
So I had this crazy idea back in 1995, right after my sister died. My sister was 36 years old. She was mismanaged and she had a cardiac arrest and died, and went on to become an organ donor herself. So I started to think, there's this new thing. It's called the internet. Don't know if you guys have heard that or not. But in 1995, it wasn't something that people thought about. It wasn't what it is today. I actually had to teach people what www meant. I would go to cardiology conferences, like, we have a website. Here is where you can get information and send your patients to. So it started off as me starting a website. And it grew and grew. And today we are a staff of 9. We have over 550 volunteers signed up to do different projects with us. We run discussion groups. We have webinars. We just had our HCM Awareness Day a couple of days ago, where we kind of featured what's going on in the community. We share patient stories. We're here to support them. We have a patient registry and a wonderful board of directors and volunteers and committees, and lots of ways for people to get involved and serve and be here to support each other through a very complicated disease process that affects multiple generations in the family.
So you were like the pre-boomer, like, this is the internet. I feel like that's how I am now. I feel like I talked to my mom and I was like, this is where we Google this. This is what you click right here.
So from a personal, I did not plan on becoming a nonprofit founder when I was planning my career. So I started out in computer programming, and that was, okay, I'm going to date myself here, and I'm a little bit older than both of you, I guarantee it. But I was the first high school class to have a PC course, okay? I learned all kinds of different programming, but I was really interested in just basic programming and PC programming. Yes, I did Fortran and COBOL and Pascal and RPG, like all these old languages that you don't use anymore. But I was fascinated by a PC when I was like 13, 14 years old, and they were just coming out. So this is like the early 80s. And I left school and I went into computer programming, and somehow, like, it was with an insurance company and it was boring and I wanted to go work someplace else. So I went to a placement agency and they're like, you do not belong locked in a computer room doing code. You're a people person. I'm like, well, yeah, I know that. And they're like, you need to work in recruitment of other people, IT professionals. So I went into recruiting. And then from recruiting, I went into HR. And from HR, I went into health plan administration. And I kind of was on that side of healthcare when my own family's health was falling apart. And I would simultaneously started the organization. I was working in human resource management. And I decided that while I was, raising my daughter, who was under a year old, and my niece and nephew were living between my parents and us, that's when I was going to start a nonprofit organization, because I was 27 years old. And why not? Ain't 27 anymore, guys. And the internet is evolved, and we now are talking over the internet rather than a telephone, and the world has changed exponentially. And just in the past 5 years, HCM has changed. So I went from www.worldwideweb. And now we just did a Hill briefing 2 weeks ago on Capitol Hill, telling federal lawmakers what we need to do to find the undiagnosed. So I went from www to the Capitol.
Go girl.
It's such a great story to tell too, of how far you've come.
Yeah, it's number one, I feel old, a little tired. I've been through a lot. I've been through a lot with my personal HCM journey. I've personally been able to work with over 20,000 families with HCM worldwide. And those are the people that have picked up the phone and called us. Those aren't just the people that we're touching because we have a website or an active Facebook or social media community. That's the people that I've actually spoken to. And they all know me and I know them, but their lives evolve. And okay, here's a funny story. This is Lisa's memory. You would think I had brain damage over my stroke, but no, I got superpowers from it. Guy 20 years ago I talked to, I helped him get to surgery. Happened to remember him because he lives in Georgia. And he raised schnauzers. That was his job. He raised schnauzers and he showed them, and he was like this schnauzer show guy. And randomly, a couple of weeks ago, my phone rings on a Friday afternoon and I'm leaving. It's ringing on my cell phone, not the office phone. And I pick it up and I'm like, yeah, the office is closed now, but you can call back on Monday. And he's like, well, I talked to you 20 years ago and you helped me with my surgery. And he starts telling me this story. And I stopped him. I'm like, do you raise schnauzers? He goes, how could you possibly remember that? I'm like, I'm crazy. I remember everything. So I've been walking the walk with these families for 20 years, 25 years in some cases. We've cried together. We've laughed together. We've recovered together. We've had ICD shocks together, surgeries, all kinds of different things, transplants. And it's an amazing community. And I'm really blessed to do the work that I do. But there's never an end to the work. There's always another family who just got the words for the first time. You have hypertrophic cardiomyopathy. What do you do? And we pick up the phone and we hold their hand and we walk through the whole process with them and make sure that they know where to get care. And partnerships like Angel Flight are going to help us get people to the right doctors before it's too late.
I feel like that right there, I'm like, sorry, Jess, I didn't mean to cut you off, but I'm like,
no, it's okay.
I feel like that right there. I'm like, okay, I'm done. You just sold us.
Yeah.
Okay, but now Jess actually does have a question. We'll let her go.
I was just going to say, how can our listeners help support your organization?
Well, first, the thing that they can do is look in the mirror and ask themselves a very important question. What is my heart health history? What has happened in my family with their heart health? And most Americans have some kind of heart disease that runs in their family. It doesn't have to be hypertrophic cardiomyopathy. It could be they have high cholesterol, or they have arterial sclerosis, or they have another rare genetic disorder. But knowing somebody's family heart health history can be the key to saving their life. So the first thing I'd ask them to do is ask the family, hey, mom, hey, dad, what happened to grandma, grandpa, aunts, and uncles? And learn about their heart health history. They want to learn more about HCM. They can visit our website at forhcm.org. They can visit us on social media. They can call the office at 973-983-7429. They can talk to an intake coordinator. We can send you a copy of our Upbeat magazine. We can get you whatever resources that you need. And you can also maybe get involved in a whole other level. We're working on state level initiatives to change the law, make sure that every child in their well child examination is asked about their family heart health history, giving that family an opportunity to have a conversation with a healthcare provider about what tests they may need to do to identify heart disease in the family. So that's what I think they can do.
I love it. Thank you so much, Lisa. And before we let you go, is there any last thought that you want to leave the listeners with? Whether it's go from the www to whatever.
I would say if you happen to have hypertrophic cardiomyopathy, because of the advances in care today, it's absolutely essential that you be seen by the highest volume possible, highest volume practitioners possible. And not all of you are around the corner for one of them. So partnerships with Angel Flight and some of our other partners can help get you to where you need to be. So don't be afraid to ask for help. Don't be afraid to say, I need some support in getting to that center. How can you help me? we are here to walk with you through the entire process. And our structure is a little unique because, hey, I'm the founder and I'm a little bit unique, if you haven't figured out by now. Don't be afraid to ask for help. Don't be afraid to say, I need help with a flight. I need help with travel expenses. We are here to help you so that you and your family can stay whole for as long as possible. So that's pretty much it.
All right. That's all we got.
Thank
And I
you
love
again
it.
for sharing.
Thank you so much for having me, and hopefully we'll have lots of great success stories to share in the future about how we've both been able to help patients get to the care that they need.
We're here for it.
Definitely.
Have a great day and enjoy your weekend.
Thank you. You too.
Bye, Lisa.
Bye, guys.
Don't
All
worry.
right. We're back.
We love when technology works. I was a little nervous because I'm like, if that did not record,
That's a lie. Maybe I wouldn't, but I
Yeah.
don't know. It's a Friday, so maybe I would. I had so many thoughts while she was talking. First, I am a year older than she was when she founded a whole nonprofit. And what the flip do I have to show for myself other than student loans and credit card debt?
you better get out there and be passionate about something. These interviews have really showed our lack of passion. But I was thinking about the start of the internet, and all I could think about were floppy disks. Are you too old for that or too young for that?
No, actually, because while she had PC classes in high school, I had them in kindergarten. Yeah, I do remember floppy disks. I do. Where like the computer sat on top of the thingy that you had to slide it in. I guess that was like the tower back then, but I don't know.
And I was thinking of what the purpose of floppy disks were. I think it was just like a USB
It was
drive,
like a
wasn't
flash
it?
drive. Yeah.
But a flat one.
Yep. These are the things that I remember from kindergarten.
All of our boomer listeners are going to be so proud of us because we're talking about the olden days.
Tom Melt's
They're
gonna
not
have so
all-
much to say.
I don't want people to make fun of us, but we just walked into that one. So
We
at least we're not
actually did.
fully in our millennial moments because we do love technology.
I was so proud when she was talking about like going and being like, this is a website. I was like, what? No boomer can talk to us about how mean we are to boomers because she boomer to boomer too.
I know.
What is it before boomers? Is that, I don't even know. What's
Mm,
before a boomer?
I don't know. I just like the boomer versus millennial war because boomers are so easy to make fun of, but millennials, we are also easy to make fun of.
We are. Both are very stereotypical groups. And
Whatever
it
the
makes
younger
it
generation is below millennials, they're also mean. They're mean to us. So now I feel like I know what a boomer
We're the
feels like
boom.
when millennials.
I know. I think they're Gen Z, maybe.
Are we
Maybe
the
Gen.
boomers now?
I don't know.
I will not accept that
Are
title
we?
until I'm at least 45.
That's terrifying. Just think about, so for listeners on here, I have a little cousin who is basically a little sister to me. But she's a sophomore in college. So every time I get a new outfit, I send her a picture and I was like, hello, am I cool now? And the answer has not been yes yet. And if anything,
Shocking.
I've sent her a picture of a pair of jeans with these like sneakers that I got. I felt so stylish. And I was like, all right, Em, what do I do? Do I roll the pants? Do I put the shoes in the pants? Do I put the pants in the shoes? Like, what's going on here? And she was like, well, those pants aren't in style, but I guess if you have to wear them, ... I was like, well, dang. I thought I
What
looked
kind of
cute.
pants were they?
Normal pair of jeans. But because they were like a straighter, skinnier leg, I wasn't cool.
Apparently nobody wears skinny jeans anymore, and I refuse to go back to boot cuts or those mom jeans, which everybody always looks so cute in, but I just look like a sack of potatoes.
Yeah. I really like, if there is anything that our listeners know, even just from watching this video or like any of the videos, like if you're a watcher, not a listener, you've probably seen the way we dress. And so you know it's not a strong suit of ours.
Speak for yourself.
Have you seen your outfit?
I still gotta find my pilgrim outfit. I'm already thinking of re-renting it, especially for the springtime that's ahead of us.
Oh my God. Well, listeners,
We appreciate you listening, and we hope we did not offend anybody. It is never our intent. You can offend us, though. We have thick
what
skin.
if we offend somebody on? I don't even think that one was mean. I've said a lot worse on here.
Yeah, the last
Anywho,
couple. I have to censor you from now on.
to figure out if there's a way for it to just go beep instead of like having to cut out like something completely, just like beep over me. But on that note, we'll see you guys next week for another episode of Takeoff Talk.
That's it for today's episode of Takeoff Talk with Angel Flight East. If you want to learn more about our services, please visit our website at www.angelflighteast.org or call our office at 215-358-1900. Join us in our mission. If you're a healthcare worker or a patient in need of air travel and flight services, AFE is here for you. Subscribe to the show so you can hear more stories. Join us again next week right here on Takeoff Talk.